The East African country of Tanzania has been enduring an ongoing healthcare crisis. Lack of skilled healthcare professionals and medical equipment, poor infrastructure, and the inadequate management of healthcare facilities are among the many factors that have led to an environment where women are 20 times more likely to die during childbirth, and there are nearly 2.5 times as many deaths from cardiovascular disease and diabetes than in the United States.
It's one of the largest humanitarian issues, if not the largest on the planet, is the shortage of healthcare workers in Africa.
A lot of people spend their lifetimes without ever seeing a doctor. They're born and they die, and then throughout that entire length of their life, they've never seen a doctor.
The Touch Foundation is dedicated to improving the health of the Tanzanian population by strengthening the overall healthcare system. Touch approaches the healthcare system as an interconnected web of elements, all of which need to be functional to enable effective delivery of care. For example, physicians are less effective without the proper equipment and supplies. Similarly, facilities with strong infrastructure are less effective without skilled healthcare workers. Touch works across the different levels of care, from tertiary hospitals down to village-level facilities. The foundation increases the number of quality skilled healthcare workers by training new and existing healthcare workers, such as physicians, nurses, lab technicians, and health institution managers, ensuring they receive quality education and assisting with their deployment and retention in areas where they are needed the most. Touch also improves the healthcare delivery mechanisms by strengthening conditions at the various healthcare facilities, such as infrastructure, supplies, and equipment, as well as improving the processes and systems for collaboration among institutions, including patient referral and transportation systems, among others. Touch's approach is effective and sustainable because it is rooted in rigorous analyses, problem-solving, and deep collaborations with local partners who own the programs from the beginning, enabling Touch to transition out once the programs have been established. To date, Touch has primarily focused on supporting the training of healthcare workers and has helped train nearly 300 physicians and more than 1,700 other healthcare workers, 90% of whom remain in Tanzania and continue to work in the healthcare sector.
A physician, any skilled healthcare worker, may save 300 lives over their lifetime of service and have thousands of people who they help. So it's very hard to find out places with that much leverage. You know, you help educate 1,000 people, then they can actually save 300,000 lives over their lifetime of service. So that's extraordinary impact.
10 years ago in Tanzania, there was one doctor for every 30,000 people. Today, there is one for every 15,000. That's an immense improvement, but still too low. To put these figures in context, Africa has one physician for every 4,000 people, while the United States has one for every 400. Going forward, Touch will continue to focus on healthcare workers, but will also expand their efforts to focus more on strengthening the healthcare delivery mechanisms, thereby ensuring that healthcare workers are empowered to provide care to patients in the most effective manner.
What makes Touch Foundation unique to me is your ability to have direct impact on something that changes the lives of a lot of people.
The VTOL Foundation supports 160 NGOs in 66 countries, so having seen the Touch Foundation work firsthand, it really stands out as a beacon of excellence. And we're really proud to support the Treat and Train program because having gone to Tanzania and having seen the magnitude of the problem, it really is going to take a model that has replicability, that can go to scale, that can solve the incredible shortage of medical workers throughout sub-Saharan Africa. And I think the problem is huge, but I think the future is bright with the model of the Treat and Train program through the Touch Foundation.
I think Touch has recruited extraordinarily high-performing people, people with more business-related backgrounds than perhaps is typical, with, I really do believe, an expectation of performance and performance measurement standards that are what I think are more typical of the for-profit world than the not-for-profit world.
Well, Tanzania is not the only country that has a shortage of healthcare workers in Africa, and there, is the old saw that it's better to teach someone to fish than to give them fish to eat every day. And as the touch model in Tanzania becomes more and more known, and its record becomes more long-standing, we think there's a real opportunity for touch to be a model for other African countries who need to develop more healthcare workers.
Well, a gift of touch is very highly leveraged. In other words, because of the generosity of the U.S. government, we can leverage the money. And there's probably nothing that you can find where you will have more impact upon improving human lives than through investing with touch.
A message to all of you gathered here this evening is that we appreciate the work that Touch Foundation is doing. So whatever you can do to help Touch Foundation deliver, do that.
Please donate today. Your gift will make a difference.